Today, I'm going to dive into 3 signs that you may have a disc herniation in your neck, signs, and how to fix it without surgery. Check it out.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum. This is Back at It with Dr. Decompression.
Hey, this is Dr. Dudum. This is the Back at It with Dr. Decompression, episode 53. I got this question yesterday. A lot of patients are asking, hey, I know you do low back, but can you do cervical? Can you do a neck decompression? So I thought I'd use this opportunity to share 3 signs of a disc herniation for the cervical spine and also share a case study and a patient that had a very, very severe disc herniation, very severe symptoms, and we avoided spinal surgery, and he is kicking butt now. So let's talk about symptoms that you might notice with a disc herniation. Number 1, any type of pain, tingling, numbness down the shoulder, down the arm, into the hand. It's kind of, think about like sciatica. Like if you have butt pain or pain into your calf or your foot, I've talked about this before, it's probably a herniated disc or a disc injury. Same thing. If it's a neck injury, disc related, it's going to go into your elbow and possibly in your hand. So think of hand numbness, pain in your hand. That would be a symptom of a disc injury. If you have shoulder pain or that pain in your hand, number 2, if you move your neck in a specific way and it relieves the pain in one direction, or if it increases the pain in a second direction, that is a very likely sign of a disc injury. For example, if I tilt my head to the side, to the left, sorry for the viewers on YouTube, on the listeners, if I'm tilting my head to the left and the symptoms get better, they go away, my hand numbness gets better. But if I look down, it gets worse. There is some type of disc injury going on that's irritating that nerve. Something that is in that space that's creating pressure on the nerve. It's usually a disc. Could be a bulge, could be herniation, could be an extrusion, something. And number 3, it's when you cough or strain to go to the bathroom. So if you're coughing and you feel sharp pain in your neck or down your spine, either into the rhomboids, the shoulder blade, or down the hand, that would be a sign of a disc injury. Those are the 3 biggest things I'll see. And yes, we see about a third of our patients are neck-related decompression patients. So I want to dive into Brent, okay? Young guy, my age, young guy. And gosh, he was suffering for about 6 to 8 weeks, severe neck pain, severe pain into his shoulder. Very common. He had an ice pick in his shoulder. He thought it was his shoulder, but it was also going down his arm into his hand. So painful in the neck, ice pick in his shoulder, and his whole arm was painful. We have an MRI. The MRI, 2 very large disc herniations, C5, C6, C6, C7. Very, very large. Okay. With decompression, you don't just always go and pull and use most of the force at the angle of the disc injury. That's textbook, but that's not always the case. You have to evaluate the patient. What will create a space? What's going to create a space for that disc to get back in there and reduce in size? How do we do that? It takes some clinical work. So we're pulling and we're trying to figure out what's the best angle to relieve his symptoms. Because if I can find an angle to relieve his symptoms, that may, with other factors, be the way to go with the angle of the table. So for Brent, he did really, really well with a flat pull, not angled, what you would think of for a traditional C5, C6 herniation. So we were pulling him flat. And like most patients that have a severe disc herniation in their neck, they are in a lot of pain. And they're just, one of the most rewarding things is to see this transformation with our patients. He was not there. He was glass-eyed. He wasn't talking to you very well. You could see he wasn't connecting with you. I mean, he was off. Everyone could tell he was off, but we knew why. We've seen this every day, and we were empathetic because we knew that it's because he's in so much pain. And within 3 weeks, his arm pain was almost 50% better in 3 weeks because we found out the correct angle, how to pull him. Our oscillation cycle was better. We knew what we were doing with the oscillation cycle. That's when the tables go out and in, out and in. And then we were slowly ramping up the weight. We didn't do the weight too much, too fast. So we didn't go from pulling the table from 0 to whoosh, a foot apart. We went from an inch to 2, 2.5 to 3. We slowly pulled him. 50% better. So what does that mean? It means his arm pain was 50% reduced. You could see the light in his eyes. So much better. He's a hilarious guy. But you wouldn't know that from the first appointment because he was in so much pain. 8 weeks later, 100% better. No more arm pain, barely any neck pain. 1 out of 10. He's doing his corrective exercises. He's coming in way less often. Excuse me. He's coming in way less often. Sleeping the way he wants to. He's back to work. He wasn't working before that. Everything is so much better for him after spinal decompression. The key was to know what's the angle. I'm showing the viewers, for the listeners, I'm showing the model. What's the angle that's going to get that disc right there to come back in? And if we can get it to come back in 20 or 30%, it's going to be enough to get the pressure off of this nerve and actually fix his problem. And he's going to be able to sleep better and go back to work and not have any arm pain. He also had a classic C5, C6 disc referral that I didn't touch on earlier that I think is worth mentioning, because if you're listening to this or you're watching and you're, maybe I have that, but I don't have arm pain. Okay. If you have that back trap area, like an ice pick or pain in that back trap area, and you've tried massages or you've tried exercises, retraction exercises or posture exercise, and it's not getting better, that's a very clear indicator of a C5, C6 disc herniation. Okay, it's a C5, C6 disc referral down to that scapular area. Now, if you do a few stretches and it goes away, it's probably not a disc injury, and that's great. But if you're struggling, you don't know where to start, that could be what it is, most likely, if it's not going away. Imaging would show that, right? An X-ray does not show disc injuries. Remember, an X-ray does not show a disc injury. An X-ray would show disc thinning or degenerative disc disease when the disc wears out and becomes dehydrated or the disc space reduces, but it does not show a bulging disc. An X-ray doesn't show a herniated disc, and it doesn't show an extruded disc. Only way you're going to find this out is if you get an MRI, which shows the soft tissue, which is a disc, an intervertebral disc. So that's how you're going to know. And those are the 3 most common symptoms that I'll see with disc injury. Arm pain, pain when you cough, sneeze, strain to go to the bathroom, like when you're increasing the pressure, called intrathecal pressure. It's between the spinal cord and the canal, the intrathecal pressure. Okay, you're increasing that, and if there is a material like a disc or something in that area that's not supposed to be there, it's irritating the nerves when you do that. That's why you get the pain. doing it. And lastly, head position affects it in a positive way, like reduces it, or it affects it as far as it produces it, makes it worse. So it centralizes it or peripheralizes it. Those are the three signs of a disc herniation I'll see. And then we talked about Brent, a case study that just kicked butt and did so well. I'm so happy for him because we found out the correct angle to pull him at. We determined the way to progress the weight, how slow to start and how fast to ramp up, which is super important. And then lastly, we determined the oscillation cycle of the table that would be most beneficial for him. So that's Brent. Happy for him. Couldn't be happier because he's back to life, being his funny self and not all glassy-eyed. So
it's obvious that you're having lower back pain and you want to get relief. Text me the word relief to 925-291-5670 to download your free low back pain guide. Start fixing your back today and get the relief that you deserve.
So, hey, if you like this kind of content and you want to know more about how to help people with disc injuries or overcome disc injuries, or you want to avoid surgery or injections, or you just want more information, don't forget to subscribe to the channel and subscribe to the podcast. These episodes are brought to you by Pillowise USA and PowerPlate. So thanks to our sponsors. I'm Dr. JD Dudum. This is the Back at It with Dr. Decompression. Thanks for listening.